Assalamualaikum warahmatullahi wabarakatuh. My name is Sokara Utaratingan from BSN3 Section E. So today I'm going to discuss or I'm going to present the simple case study entitled Bipolar 1 Disorder. So, first is yung definitions of the disorder. So, bipolar 1 disorder, it is a type of mood disorder characterized by at least one episodes of mania which may be preceded or followed by hypomanic or major depressive episodes. And next is yung sa psych history niya is we need to identifying data. So, sa identifying data is napapaloob dito yung name, age, gender, date of birth, civil status, and yung children ng ah client natin. So, ang name ng client natin is si Jalal Samad Mustafa, age 37 years old, gender male, date of birth November 7, 1988, and then yung civil status niya is na separated siya since 2006 for 17 years. And then meron siyang one daughter and currently grade 9 na siya. And then pangalawa is yung chief complaint. So according sa video na sinend nila sa GC is kung na-open nyo yung video is yung chief complaint ng patient natin is sabi niya is mood changes, episodes of aggressions and behavior suggestive of bipolar disorder reported by Dr. Sally consultations of CDU. And then pangatlo is yung history of present illness niya. So sa history of present illness niya is yung onset is symptoms began 15 years old siya. And then precipitating factors, separations, stress, medication non-compliance, and then predisposing factors. So sa predisposing factors is ito yung family history of mood disorder and early onset. And then pre-morbid personality. So according sa client is no specific trait mentioned but possible signs of emotional vulnerability. And then, pang-apat is yung past illness niya. So, first is yung sa psychiatric. Sa psychiatric is na-diagnose siya with bipolar disorder, episodes of depressions and manic phases, and previously prescribed valproic acid and risperidone. And then, sa medical niya is according sa SO is no specific medical illness noted, alcohol and substance use history. So, no mentions or indication substance abuse din. And then, panglima is yung family history. So, sa family history is pumapasok dito yung prenatal and perinatal, early childhood, late childhood, adulthood, sexual history, fantasies and dream and values. So, sa prenatal and perinatal is no remarkable history, no prenatal complications and reported. So, sa early childhood niya is raised by mother, normal childhood until magkaedad siya ng 15. And then, sabi niya din is no father figures. And then, late childhood, live without a father figure, some emotional difficulties noted. And then sa adulthood niya is separated for 17 years and then currently co-parenting. And then sexual history, some issues with intimacy and attachment suggested. Sa fantasies and dream is not detailed, and then values not explicitly mentioned. And then, sa occupational history, work and medical field, began working at 15 years old, possibly in a hospital or medical environment. And then, pangalawa is martial and relationship history. So, separated for 17 years and one daughter, had a previous live-in partner, and then currently living separately from the ex-partner. And then, military history, So, according sa interview is, sa military history niya is naka-enroll siya and ROTC during third year of high school. And then, educational history, reach at least high school, ROTC mentioned, possibly higher educations. And then, religion, not explicitly state in the notes. And then, social activity, describes some social withdrawal and instability. And then, for interpersonal interactions during certain phases. Participates in play therapy during manic phases. And then, sa legal history niya is COVID-19 related legal issues mentions. And then, unclear specifics. And then, proceed tayo sa psychodynamic by psychosocial developmental by Erik Erikson. So, psychodynamic view, Erik Erikson, psychosocial developmental stage. So, yung patient natin, si Jalal, is currently within Erikson intimacy versus isolation stage, which typically occurs during young adult age 20 to 24. This stage emphasized the importance of developing close, meaningful relationship, and Jalal situations, the breakdown of marriage, and his tendency to withdraw socially indicate a move toward isolations. His aggressive behavior may stem from unmet emotional needs and difficulty in building trust, would hinder his ability to connect with others. And then, proceed tayo sa sign and symptoms. First na sign and symptoms is yung manic episodes, extremely high or irritable mood, and then too much energy and very active. And then, needs little sleep, talk rapidly and then racing thoughts, inflated self-esteem or grand ideas, risky behaviors. And then, depressive episode, persistent sadness, loss of interest, appetite changes, and fatigue, and feeling of guilt or worthlessness. And then, proceed tayo sa medical management. So, sa medical management is meron tayong managing manic episodes. So, dito sa managing manic episodes is use mood stabilizers such as lithium valproate and carbamazepine to help mood swings. And then, sa atypical antipsychotic, pumapaloob dito yung risperidone, olanzapine, aripiprazole, tumutulong siya para ma-reduce yung maniac weekly. And then, short-term benzodiazepine like lorazepam or clonazepam may be used to calm severe agitations or help with sleep. And then for depressive episodes, pumapaloob dito yung lorazepam are options for treating bipolar depressions. Sometimes antidepressant can be added, but always together with stabilizers to prevent triggering mania. And then for long-term maintenance, lithium remains the gold standards for preventing future episodes and lowering suicide risk. And then during manic episodes, provide a safe environment to prevent harm from impulsive or risky behaviors. So, nagre-reduce din siya ng external stimuli. So, pumapaloob dito yung quiet room, and then limit visitors. And then sit clear, consistent, limit, and explain rules calmly. Use short, simple communications because patient may be easily distracted. And then the last one is encourage rest and adequate food and fluid intake. They may neglect this due to high activity. And then, during depressive episodes is nag-offer tayo ng emotional support and kailangan natin mag-build ng therapeutic trust. And then, we need to encourage self-care like bathing, eating, and grooming. And then promote social interactions at a pace that patient can handle. Monitor for suicidal thoughts or behavior and act immediately if risky is high. And then for general care, we need to educate the patient and family about the illness and importance of medication adherence. And then observe for side effect of medications like tremors, weight gain, and sedations. So next is we need to encourage the patient or the or the family member to the regular sleep routine and healthy lifestyle. And then we need to collaborate with the healthcare team for psychotherapy or psychoeducations. And then for the recommendations, take medication consistently. Don't stop without consulting your doctor. Attend regular checkup to monitor mood and medication side effects. And then establish a daily routine like sleep, meals, activities to help stabilize mood. And then um, i- i-educate natin yung patient or to avoid alcohol and recreational drug as they can trigger mood episodes. Next is practice stress management like relaxations technique and mindfulness, and then join support group or therapy for added guidance and emotional support. And then for MSA, mental status examinations, first is yung appearance. So sa appearance is according sa video ng mga nag-interview is the client's appear when clean and will keep suggesting that he maintains good personal hygiene. His clothes are appropriate and neat, and he looks like he has recently taken a bath. There are no visible signs of neglect and grooming. His posture is relaxed but proper, and there are no abnormal movement or signs of discomfort. And then sa pangalawa is yung speech. So according sa pagsasalita ng patient is within normal range in terms of speed, tone, and volume. He is able to communicate clearly and appropriate during the conversations. His sentences are organized and coherent, and he responds to questions without delay or difficulty. There is no evidence of slurring, mutism, or pressure speech. And then pangatlo is yung sa mood. So the client's mood affairs is stable and consistent throughout the observations. He does not show any signs of extreme emotions such as sadness, anger, or euphoria. And then his emotional state seems calm and appropriate to the situations and does not appear agitated or distressed. And then, pang-apat is yung thinking. The client thought process is logical and well organized. He is able to express his thought clearly and respond appropriately to questions. There are no signs of flight of ideas, tangentiality, or circumstantial thinking. His content of thought is appropriate with no evidence of delusions, hallucinations, obsessions, or suicidal thoughts. And then panglima is yung perceptions. So sa perceptions is there are no observable signs that the clients experiencing hallucinations or perceptual disturbance. It does not appear to be responding to internal stimuli, and he does not report seeing, hearing, or sensing things that are not present. No illusions, the realizations of the personalizations were noted. So, pang-anim is yung sensorium and cognitions. So, sa alertness is the client is fully awake and responsive. He is aware of surrounding and shows no signs of drowsiness or confusions. And then, pangalawa is yung orientations. The client is oriented to all their spares time, place, and persons. He know the current date, locations, and who is and who others are around him. Concentrations, he is able to focus on tasks and questions, although there are occasional moment where he seems uh, slightly distracted. However, he quickly regains focus. And then, pang-apat is yung sa memory. The client show an intact memory. He can recall both recent and distant events. For example, he remember important personal experience and he can share them with clarity. And then sa calculations, he is able to perform simple mathematical tasks indicating that his basic cognitive functioning and arithmetic skills are intact. And sa abstract thinking is the client is capable of abstract reasoning, is able to understand and explain the meaningful behind common proverbs or think beyond concrete ideas. And then, yung pampito is yung sa insight. So, the client shows good insight into his conditions. He is aware of the symptoms and he is experiencing and understand that they are part of a mental health issues. And then, he can talk about his situations with understanding and acceptance. And then, pangwalo is yung judgment. Sa judgment is the client demonstrates appropriate judgment when presented with hypothetical scenarios. He can make sound and reasonable decisions. He understands the consequences of his actions and shows the ability to consider what rights or wrong in different situations. So, proceed tayo sa drug study. So, sa medications is risperidone. Yung generic name niya is risperidone. Brand name is Risperdal. Route niya is oral. Dosage is 2 milligrams and frequency is OD. So, classification in action. So, sa classification is yung antipsychotic and benzoxazole. And then sa actions is mechanism of actions not fully understood. Block dopamine and serotonin receptors in the brain, depresses the RAS. And then alpha adrenergic blocking activity may contribute to some of its therapeutic and adverse actions. And then, proceed tayo sa indications and contraindications. So, itong gamot na to is gamot siya para sa schizophrenia, and then delaying relapse in long-term treatment of schizophrenia. Unlabeled uses bipolar disorder, treatment of patient with dementia-related psychotic symptoms, and contraindicated with hypersensitivity to risperidone and lactations. And then, use casually with cardiovascular disease, pregnancy, and renal or hepatic impairment, hypotensions. And then, proceed tayo sa adverse and side effects. So, isa sa mga adverse and side effect ng gamot na to is yung insomnia, anxiety, agitation, headache, aggression, dizziness, dry skin, photosensitivity, nausea, vomiting, constipations, abdominal discomfort, dry mouth, and then increased saliva, coughing, sinusitis, pharyngitis, dyspnea, chest pain, back pain, fever, neuroleptic malignant syndrome. And then, so, yung nursing responsibilities ng gamot na to is meron tayong before and after. So, before, we need to maintain seizure precautions, especially when initiating therapy and increasing dosage. So, sa dosage niya is we need to observe patient carefully when administering medications to ensure that medication is actually taken and not hoarded. And then after, advise patient to take medications as directed. Take MACE doses as soon as remember, with the remaining doses evenly spaced throughout the day. And then we need to monitor the temperatures if fever is occurs. And then, ang pangalawang medication na tinitake ng ating patient is yung valproic acid. So, brand name niya is Aleptis, Dipacon, Epical, Dipamax. And then, route niya is oral, dosage 250 milligrams, frequency is 3 times a day. So, ang mechanism of actions niya and indications is, sa mechanism of actions is inhibitors, neurotransmitter in the brain, and then indications niya is bipolar disorder. So, side effect and nursing responsibilities. So, sa side effect is merong makikita sa gamot ng side effect na to is yung nausea, drowsiness, and dizziness. And then, sa nursing responsibility, we need to monitor the liver functions before and during therapy, assess for unusual bleeding or bruising. And then, proceed tayo sa pangatlong medication, yung Bipiridine. So, brand name niya is Akidin. Route niya is oral, dosage to 2 milligrams, frequency a day. Classifications niya is anticholinergic. So, mechanism of actions and indications. So, sa mechanism of actions niya is a blocking acetylcholine receptors in the central nervous system. And then, sa indications niya is Parkinson's disease, extrapyramidal syndromes caused by antipsychotic drugs. And then, side effect and nursing responsibilities. So, sa side effect ng gamot na to is makikita dito yung dry mouth, drowsiness, nervousness, and blurred visions. So, sa nursing responsibilities, we need to monitor for the therapeutic response, assess for anticholinergic side effect, and monitor the mental status. And that's all. Thank you.